I raised it before. Mr. Speaker, the problem we have with the implementation of SHA and SHI, it's about the clarity of the transition. Mr. Speaker, when the government decided to move from NHIF and now to the SHA, which is the authority, and with the benefits that we are being given by the chair from SHI to the emergency to the primary care, there was no proper communication and clarity on the benefits. As a former chair, Mr. Speaker, yes, NHIF had many challenges, but when patients visited hospitals, they knew what to expect. So a patient who was to go for dialysis, a patient who was to go for chemo, and who are majority of Kenyans, Mr. Speaker, they knew when they went to hospital what they were to pay and if they were to top up. Unfortunately, Mr. Speaker, when the 1st October came, I also became a victim. I had a patient in hospital, and even with an insurance, Mr. Speaker, it was very difficult to claim what was meant to be NHIF, which now had become SHI under the SHA authority. And so, Mr. Speaker, I would urge the chair of the Health Committee, these members, and I know even yourself interact with your constituents, it is the high time whether we can even be able to do a public participation.
The Social Health Authority was well intended to ensure that every Kenyan gets access to good health care. But I want to agree with my colleagues that there are challenges in transition. Just like any other program or project, there will be those teething problems when it's being implemented. And I think that is where we should focus. But there are also success stories. Honorable Speaker, I'm just from my constituency. The whole week, I was not in Parliament last week. And I did public participation. And one of the issues I was sensitizing my people on was on SHA. And they said, Mheshimiwa, we did not know. And the information the chair was telling us, we needed to sensitize and educate Kenyans so that they know what is SHA, what is the premium, how do they benefit, how do they pay. That information is lacking. And while we were doing public participation, one of my constituents, when returning back home, broke his hand. And we rushed him to hospital, to one of the private hospitals in town, and we were told we needed to deposit 100,000 cash money, which we did not have. I demanded that the patient is transferred to Bungoma, where we looked for a hospital. We were being told 70,000 we did not have. But before we went to Bungoma, I made sure the patient was registered with SHA. So we managed to get a hospital in Bungoma Hospital that accepted to admit this patient from Busia County, Teso South, and he was treated with SHA, and I only paid 25,000. And as I'm talking to you, he was discharged yesterday. So the problem is lack of information. The problem is equipping our hospitals properly. And Honorable Chair, Speaker, the Chair of Health, I want you to listen to me. We must put a proper budget to health so that we are not depending on donor funding. Diseases like cancer, in the last budget, we only gave them 250,000 for both recurrent and for them to establish cancer centers across the country. What can 50 million do? 200 million was for recurrent. So we need to equip. You go to Busia National Hospital, you find 3 mothers from the maternity sleeping on one bed. We must improve the facilities even as we work on improving the transition to SHA. The problem is in our facilities, equipments, and we need more doctors in our hospitals, Honorable Speaker. Thank you.
The Honorable Sarah Korere.
Thank you, Speaker. And Speaker, I want to thank my sister, Honorable Lilian Gogo, for bringing this adjournment motion. Honorable Speaker, as other speakers have said, she or SHA was well-intentioned. But Speaker, the trust deficit that it has brought about, the lack of stakeholder engagement is one thing, Mr. Speaker. And I say so because in every county, in every constituency, we have government officers up to the level of assistant chief. So, Speaker, if all the administrators were called and educated about this insurance fund, and given the requisite information. These people are paid by government, the assistant chief, the ACCs, the DCCs. You know, we cannot, depend on politicians who will politicize everything and want to seize the moment, even on things you had passed on this house, just to paint how bad some things are, because they think they are on the other side of the division. And Mr. Speaker, as I stand here, my pay slip has been cut, and so are other civil servants. We feel the pain on the cut, but Mr. Speaker, will really enjoy when our people get services. Every member here, I'm sure every weekend, you are being called for some arambe, even when they know they banned arambes. You are being asked to contribute for some sick person. It is humanitarian. You can't start telling them arambes were banned. And Mr. Speaker, you know, health is not a privilege to Kenyans. It is a basic human right. It should not be a luxury. We don't have the option of deciding whether Kenyans should have a proper health coverage. They must. It is a must, Mr. Speaker. So what am I saying? This thing requires a proper stakeholder engagement. We create proper awareness. The trust deficit, you know, we should be honest to ourselves as leaders. For a very long time in this country, health has been a privilege of the rich. And I think that is what the president is trying to change. It should not be a privilege of the rich. It should be a right of every Kenyan. And Mr. Speaker, we know a healthy nation is a wealthy nation. You know, if our people are healthy, they'll go about their businesses. You know, they will contribute to the economy of this country. So, Speaker, it is not whether we are going to provide them with it. We must. And as a house, we must take responsibility. Those people, you know, NHIF was marred by a lot of corruption. Even as we...
The Honorable Beatrice Elachi.
Thank you, Mr. Speaker.
I'm going to take a lot of time this side.
Thank you, Mr. Speaker. Mr. Speaker, I also rise to thank our sister, Dr. Lillian, but more importantly, for just giving me the opportunity, because last week I walked into the Committee of Health to get to understand. And Mr. Speaker, this health cover is the best for Kenyans, yes. But what we need to understand, and what the committee and our chair of health needs to understand, you cannot have a system where you appreciate the hardware, but you forget software is what will make the hardware work. And that is the crisis we are in, Mr. Speaker. One of the things I need them to come and explain to us, in all insurances, there is a cap. You know, in Shif, you don't have a cap. So if someone is paying based on your salary, you are just paying. And those are some of the things Kenyans are feeling. They need more explanation. There must be a cap on this. Mr. Speaker, the other thing is that it is time for all of us, members of parliament, to put a desk in our constituencies. Let us register our people through our community health workers so that we see these numbers, so that we now get to understand, and even as ourselves, to have a tent here, outside here, in our own bunge, for us also to know whether you have registered, yes. But if I go on my phone, it does not show me that this month I was able to contribute the money. So how will I know that I'm contributing? So it needs that system analysis is where there is a big problem. And Mr. Speaker, there is worse problem in the digital one, where we have all these multi-agencies that have brought us into this crisis. Yet we bought a machine for nearly 1 or 4 billion. We should not be in this crisis. We should be now having a health cover, and we should be now celebrating that we have a health cover for everyone, but not going into the crisis we are going in. And then we find putting our president into a lot of challenges because of what we have done. And yet it is just in the Ministry of Health where we have that confusion, Speaker. And this is the time that they must come here through a Kamkunji, realign everything, tell us how the claims management system works, tell us very well how the counties are going to, they are benefiting, yes, But then, how do people register for their county hospitals to benefit is very critical. Therefore, thank you, Daktari, but we need a Kamkunji very fast.
The Honorable Guyo Jaldes.
Thank you, Mr. Speaker. I think what we need to know, the concept of universal health care is the best thing for this country, where anybody can walk into any health facility and get appropriate quality treatment is what we all need. And that is what SHA is expected to address. The problems we have today on SHA, and I'm sorry, the majority leader was teasing people. They do not know the SHA, the Shif, and the rest. And he's the one who's telling them, waving to them, say yes, say yes. And they are saying yes because they were obeying his orders. And today, he is telling them that they do not know what they voted for. I wish he was here to accept, to hear this.
Honorable Guyo Jaldesa, so many of us have just agreed we don't understand the systems.
Thank you, Mr. Speaker.
In fact, that is why I'm giving more members of the Health Committee a chance to speak to the public and to fellow members.
Yes. So, Mr. Speaker, Ruku is thinking about what to say. But, Mr. Speaker, this is a good thing. This House approved that motion. It approved through all the 3 readings. And it's unfortunate that our members of parliament do not understand what they passed. And for that, I think we agree that we need to have a Kamkunji for members of parliament so that when they go out to the public, they know what to tell the people of Kenya. We know there are teething problems. Any problem, any project that you are starting as a teaching transitional problem, that it should be sorted out. So last week when we met the SHA team, we said that even Parliament, they should even open a tent here for them to register members of Parliament and their staff so that they understand these things and ask more, and then they go out to the public and tell them what to do. Final, because I can see that the thing is changing. The counties have collapsed and it's giving us problems. But my appeal, do not close any of the former NHIF branches and do not lay off the staff of NHIF who have been working for NHIF just because we have changed from NHIF to SHA. Thank you, Mr. Speaker.
The Honorable Gideon Ochanda.
Thank you, Mr. Speaker. Mr. Speaker, the juggernaut that is in front of the nation is basically a combination of factors, but the very basic one is poor learning experiences. We've learned this many times before. You've seen this many failures before, but it's like we didn't learn. So because of that, we have not connected those learning experiences to how to communicate with the public and how to manage transition. So this is basically the main problem that we have as a nation. All these registration processes have failed before. In the last parliament, we placed 6 billion each year for 3 years for purpose of registering indigents. Nothing came out of it. We've seen in the past registration even of basic things like the Huduma number. It failed the nation. So anytime that we are talking about registration of any manner, we must learn from that the past experience to package how we communicate with the public. And that's where the biggest problem is. What I was talking about is fantastic, but the public don't have it. Who is it that is supposed to be communicating with the public? I don't think it is the member of parliament who is supposed to be communicating the official communication of the government to the public. They can only help, but there's a basic office, there must be a basic segment, there must be a basic department of government that communicates with the public officially about government things. And that's exactly why we have not, the way we have managed, for example, ID, we initially had that big thing. It remains, it works. Then we change to the small ones. So the old one works through for a long period of time. Why don't we have even those registration of NHIF and the rest that we had before work through to the entire period so that we don't put a stop or an end to an exercise that we know must run on for a long period of time? Even the registration process, even the start date of SHA has failed to pick up in the last 2 years. So those kind of things makes the public not to trust, not to get the information the way they want, so that believing becomes a problem. We must reorganize how we communicate for us to deal with the public. Thank you, Mr. Speaker.
Honorable Dr. Makali Mulu.
Yeah, thank you very much, Honorable Speaker. Honorable Speaker, I just want to join colleagues in appreciating this motion. And I want to say this, Honorable Speaker. I want to go on record that I participated in passing this law, the 3 pieces of law. There are things we objected to. We said they don't make sense, but as usual, our voices were buried. Now, one of them, which is critical, Honorable Speaker, is when you're introducing a new program, if we are programmatic in terms of thinking, there is always what we call the piloting phase, so that you pilot, and as a result of the lessons learned from piloting, then you roll out to the whole country. And I think that's what Dr. Ochanda is saying, that the interface, we missed it. That's why we are facing so many challenges in terms of the transitional phase of it. The second matter, which is critical, Honorable Speaker, you remember the issue of the staff was very, very hot in this, a very hot debate in this House. And we said it's important, we assure the staff, the NHIF staff, that they will be taken care of in terms of transition. Now, we have an authority here which has come on board. They are using a very demotivated staff because they have not come out clear what is the fate of the NHIF staff. As a result of that, they expect them to work as if they are very happy. And these are some of the things you don't get right and you fail. The third point, Honorable Speaker, the issue of the budget. The allocation has been less than a quarter of what is expected. But to make things worse, we come here and publicly announce that we have a digital system which we are going to install, which is going to cost 104 billion. You are telling us you have no budget to roll out the program, and you are buying a digital system at 104 billion. These are the issues, Speaker. So, Speaker, we are saying the government should be able to listen, so that when Kenyans are saying this thing is not working, can we allow Kenyans time? We say let's allow another 4 months so that we have that interface, NHIF and SHA. And if we do that, Honorable Speaker, you find within 5 months, we'll actually phase out NHIF and have Shif coming on board, but in a very smooth way without really disturbing the process as it is now. Thank you, Honorable Speaker.
The Honorable Irene Mayaka will be followed by the Honorable Andrew Okwome Adepu.
Thank you, Honorable Speaker. And Honorable Speaker, I just want to express the sentiments of majority of members here that one of the biggest gaps in SHA and Shif is the lack of communication, either to the public, to us, the members